As you may know, men are born with an X and a Y chromosome, and women are born with two X chromosomes. Turner syndrome is a genetic defect in which the women affected are born with only one X chromosome. Turner syndrome can cause a number of side effects. As you can see in this diagram, the side effects include short stature, heart defects, skeletal abnormalities, non-functioning ovaries, high blood pressure, kidney problems, and several others. Today, I'm going to discuss 3 academic articles that cover the treatment options available to those who suffer from Turner syndrome. In 2014, Daniel Toft, who has a PhD in endocrine disorders, covered the topic of estrogen replacement therapy. Estrogen replacement therapy helps to combat the physical and sexual development disorders that are often associated with Turner syndrome. Estrogen replacement therapy prompts the body into initiating puberty and to uphold sexual development and maintain function. Estrogen therapy replaces hormones that the body cannot create itself. It is often implemented through pill or patch depending on what is prescribed by the physician. Estrogen replacement therapy begins once growth potential ends. This makes the stopping and starting of the therapy tricky. Some girls are still able to have a normal puberty with Turner syndrome, which makes beginning the estrogen therapy easy. In most cases, however, the girls have delayed or non-existent puberties, which makes beginning the therapy tricky. In these cases, the therapy is often implemented in the ages between 11 and 14. The patients will then continue the estrogen therapy throughout adulthood until they reach menopause. Estrogen replacement therapy helps to correct a number of physical abnormalities such as breast development or lack of feminine curves. While estrogen therapy is available to assist with sexual development, growth hormone therapy is available to help with physical development. In 2008, Bessie Spiliotis, who is a writer for the National Library of Medicine, did research on the recombinant human growth hormone therapy. She found that growth failure can be discovered in patients with Turner syndrome as early as 1 year of age. The optimal age for beginning human growth hormone therapy is still not established. It is typically implemented around the age of 9. A recent trial shows that physicians implemented the therapy in patients as young as 2 years old. This trial yielded positive results, which may cause physicians to reconsider the optimal age for implementing therapy. Recombinant human growth hormone therapy is the treatment of choice for Turner syndrome patients. So far, it has proven to be safe with no adverse effects on the glucose metabolism or cardiac functions of Turner syndrome patients. Growth hormone therapy allows the patient to achieve normal adult height, pubertal development, and bone mass. This allows them to maintain a good quality of life. While these therapies are available to assist with physical and sexual development, there are also options available to help with the other side effects of Turner syndrome. Ronit Aber conducted research at the Department of Obstetrics and Gynecology at the Rabin Medical Center in 2001. He found that the most common step to maintaining fertility in Turner syndrome patients is to cryopreserve ovarian biopsy samples. For this procedure, the age of surgery is dependent on the individual case. However, it is preferable to preserve the biopsy samples before the first signs of puberty. Most or all of the elemental follicles can be lost once puberty begins. Another option for Turner syndrome patients is ovarian transplantation. To date, there are only 5 reports of human cases, and all of them showed follicular development. There are fewer risks associated with this procedure when it's done with Turner syndrome patients than with cancer patients. This makes Turner syndrome patients' likelihood for candidacy increase for the option of ovarian transplantation. Turner syndrome occurs in 1 in every 2,500 female births. While Turner syndrome can create developmental issues, there are several methods available to help, such as estrogen replacement therapy, recombinant human growth hormone therapy, and cryopreserving ovarian biopsy samples. It is a rare disease, but it can be detrimental to those who are affected. Several options are available to alleviate the pain and distress that can be caused by Turner syndrome. However, with all the efforts being made, there is always the possibility of new plans in the future. I didn't mean to say plans, I meant to say option.